Hello, everyone, and welcome. Today, we're going to be talking about medication as a tool for successful weight loss. My name is Dr. Lauren Lemieux, and I'm a physician at Form Health. I'm board certified in internal medicine, obesity medicine, and as a physician nutrition specialist. And I'm joined today by my colleague, registered dietitian Casey Curlin, who has over 15 years experience in weight management. A few announcements before we get started. This webinar is being recorded, but your participation is completely anonymous. And we encourage you to ask questions or leave comments in the chat feature. And at the end, Casey and I will have some time to answer them, and we'll try to get to as many as we can. So with that, let's get started. Today, we're going to start off by talking about challenges that come up when people are trying to lose weight. We'll review the available tools for weight loss. And then we'll go into further discussion about FDA-approved medications for weight loss. For many people, weight loss is challenging. It can feel like the efforts that you're trying to make to lose weight, like decreasing your calorie intake and increasing your physical activity, are working against you, and the weight keeps coming back. And I think this picture of the tug of war illustrates this point very well. And in fact, research shows that there are physiologic changes that occur after someone loses weight that serve to slow their metabolism, increase their hunger hormones, and decrease their fullness hormones that then promote weight regain. And this can be extremely frustrating. Now, I do want to point out that this concept of calories in and calories out is a very simplistic model. And these are just some of the contributing factors that affect a person's weight. In fact, there are many more things that contribute to this, and it's very important for anyone who's pursuing weight loss to come up with a comprehensive as well as personalized plan that addresses each individual's unique factors. Research has shown that there are key foundational tools for weight loss, and these specifically are nutrition, physical activity, and mindset shifts. And it's important to reflect on your own unique situation and where those things may need improvement or where you're doing really well with them. But for some individuals, despite using these foundational tools, they're just not quite enough. And that's where we might consider our other tools. At this time, these include things like medications as well as surgery. Now, I could talk for hours about these foundational tools as well as Casey could, and we love talking about them with our patients. But today our focus is going to be just on the medications primarily, and if we have time later in the question session, we can talk a little bit more about the foundational tools as well. These foundational tools are so important, and studies have demonstrated that combining them with medication can result in more weight loss. Now, this is an older study that was published in 2005. And you can see here, what we're looking at is weight loss at a year in patients who are using different tools. In this first group here, we see patients only using a medication. The second box are those who are using only lifestyle counseling. And then we see here the addition of medication plus more intensive lifestyle counseling resulted in more weight loss. And you may be surprised to see that actually patients who engaged in only lifestyle counseling lost more weight than patients with medication alone. Now, I will point out the medication that was used in this study is no longer on the market, but numerous studies have come out since then using medications we currently use that demonstrate the effectiveness of lifestyle change plus medication. A more recent study published in 2020 looked at liraglutide, which is a GLP-1 receptor agonist, and we'll talk about those in a little bit. And it included intensive behavioral therapy. So these patients were either given liraglutide, which is that dark blue line, or a placebo, which is a substance that has no therapeutic benefit. And you can see here with the placebo and the intensive behavioral therapy, people lost weight. But when adding in the medication liraglutide, they actually lost more weight. So these are the current FDA-approved medications for weight loss. They include our GLP-1 receptor agonists. These are liraglutide, also known as Saxenda, and semaglutide, also known as Wegovy. naltrexone bupropion, which goes by Contrave, phentermine, which has a number of different names, but Adipex P, Lomira are some names that you may encounter, phentermine topiramate, which is Qsymia, orlistat, which is Xenical, if it's by prescription, or Ally over the counter, and Plenity. Now, I'm going to point out here, there are a couple asterisks on phentermine, just so that you're aware, phentermine is a controlled substance. So if you're working with a doctor at Form Health, these controlled substances are not prescribed because our visits are done entirely virtually through telehealth and not in person. And then Plenity technically is classified as a medical device, not a medication. And I'll explain why that's the case in just a minute. So a question that often comes up for patients is, okay, there are these medications, but how are they going to help me lose weight? Well, primarily the majority of medications work by acting on our appetite centers in the brain and effectively decrease our appetite and cravings. These include the GLP-1 receptor agonists, naltrexone bupropion, phentermine, and phentermine topiramate. Specifically, GLP-1 is a hormone that our body naturally produces that decreases our hunger and makes us feel more full. And the GLP-1 receptor agonists basically act like this hormone. Furthermore, they can slow digestion, further promoting those feelings of fullness. Orlistat does not act directly on the brain. It actually works by blocking the absorption of fat from the diet. So if a patient eats a diet that contains fat, the calories from fat will be significantly reduced and not absorbed by the body. And then Plenity. Plenity is a couple of capsules that one takes with 2 large glasses of water. So it seems like a medication, right? But what it does is it turns into this fibrous gel and actually occupies space in the stomach, taking up about a quarter of the stomach volume. And that filling of the stomach activates our stretch receptors, helping us feel full. But because it's not absorbed by the body, it's not considered a medication. There are also other medications that are approved by the FDA, but not specifically for weight loss. They're approved for other medical conditions. These include the GLP-1 receptor agonists like Ozempic and Rybelsus, which are also semaglutide, metformin, naltrexone, topiramate, and zonisamide. So you may be asking yourself, why might I use a medication on the right side of the list? Well, let's take, for example, a patient who perhaps is a great candidate for a GLP-1 receptor agonist like Saxenda or Wegovy, but the medication is not covered by their insurance and is extremely expensive out of pocket. It may be that Ozempic is covered by their insurance, and so we might use that medication for that patient. Alternatively, let's say a patient is taking bupropion for depression. We may choose to add in naltrexone rather than switching to Contrave, which contains bupropion and naltrexone. I think it's also important to discuss what weight loss medications don't do. So they do not significantly rev up your metabolism, helping you burn 500 extra more calories a day. The only major way to do that is by physical activity and building lean muscle. Furthermore, they do not replace a healthy diet and physical activity. And while a healthy diet and physical activity are key foundational components for weight loss, their benefits are far greater than what you would see in terms of a number on a scale. We know that a healthy diet and physical activity is so important for preventing many different diseases, cancer, for even treating diabetes, and improving cognition. So just a big plug for the healthy diet and physical activity component. And honestly, I don't think scientists will ever create a pill to replace that. Furthermore, weight loss medications don't address underlying life stressors that may be contributing to weight gain. And they definitely don't work for everyone. So patients often ask me, how much weight can one expect to lose with a weight loss medication? And the answer is, what I can tell you is based on what we have from our studies, which are on average with the weight loss medications, we see between about 5 to 10% of body weight loss from the starting body weight. Now, the newer medication, Wegovy, semaglutide, did demonstrate a bit more weight loss, closer to 15% average body weight loss. But keep in mind, these are averages. And the medications for some people may work very well, and in other patients, they may not have an effect. So that's why it's really important to work with a doctor who's knowledgeable about these medications and can help make the best choice for you. At this time, we don't have a blood test or any genetic test to tell us which one is most likely to be effective. And that's why, luckily, at this time, we have various options for patients. I also think it is so important to understand that there is the potential for weight regain after stopping a medication. And when I have a discussion about weight loss medications with patients, I often tell them, I don't think of them as just weight loss medications, but also weight maintenance medications. And why is that the case? Because the same biological forces that contribute to the weight regain and that tug of war picture I was talking about are those that are being effectively diminished or blocked by the medications. So if you stop taking the medications, the hunger feelings come back and weight regain is more likely to occur. And I think this is illustrated very nicely by this study that was published in 2021, looking at semaglutide or Wegovy. And what you're seeing here is a graph of the change in body weight over time. In the orange line, these are patients who are taking semaglutide, and you can see over time their weight is going down as they're taking the medication. At week 20, which is illustrated here with this dash line, they took the patients and half of them, they continued with semaglutide. That's shown in the dark blue line, and you can see over time they're continuing to lose weight. The other half was switched to a placebo, so something that has no therapeutic effect. And what I think is really important to take away from this graph is that they did not stay at the weight that they were down to. In fact, they started regaining weight. And so it illustrates the potential for weight regain when stopping medication, which has been shown in other studies with other medications as well. So who is a candidate for a weight loss medication? First and foremost, patients who've been unable to lose or maintain the weight that they've lost with lifestyle changes alone, like a low-calorie diet and increased physical activity. In fact, many insurance companies require that patients have already attempted these lifestyle changes for 3 or 6 months before they will cover a weight loss medication. Additionally, there are specific body mass index cutoffs that are recommended for these medications, which are a body mass index or BMI of 30 or higher, or 27 or higher with a weight-related comorbidity. And that could be anything from diabetes to high cholesterol, heart disease, high blood pressure, sleep apnea, and so on. Now, body mass index or BMI is something that can be calculated with your weight and your height, your weight in kilograms and height in meters. And there are a number of different calculators online where you can plug these numbers in and find out what your body mass index currently is. Keep in mind, body mass index is actually not affected by age or sex or ethnicity. The other thing to point out is that medications are indicated for starting at these body mass indices. However, let's say you start a medication with a body mass index of 28 and you have high blood pressure. And with the medication, you've successfully lost weight. Maybe your body mass index is now down to 25. And perhaps you no longer have high blood pressure that requires medication. It's well controlled with the weight loss and a healthy diet. In some cases, there may be issues with insurance coverage of these medications. So that's why it's very important that we think carefully about when we start a medication with a patient. And that's why doctors are advocates here for helping our patients continue the medications that have helped them successfully lose this weight. And finally, medication is to be used in addition to a reduced calorie diet and increased physical activity for chronic weight management. So what is Form Health's approach? At Form Health, you are paired with an expert physician who's board certified in obesity medicine and an experienced registered dietitian. And together we get to know you. We work as a team to identify these key foundational components, nutritional, physical activity, mindset shifts that we can work on with you and help strategize your personalized plan. And one of the really neat things about Form Health is that this is done entirely through telehealth. So you get to meet with your doctor and your dietitian virtually from the comfort of your home. You don't have to go to the doctor's office, pay for parking, wait in the waiting room forever. It is really a very nice setup. And we have an app that allows you to track your weight, upload pictures of your meals, and connect with your doctor and dietitian so you can ask questions and have that support and accountability. And research has shown this type of tracking of weights, food intake, and the support are really key components of successful weight loss as well. Furthermore, because you're working with a physician, there may be a discussion of whether or not medications are appropriate, and if so, what might be an option for you. So with that, I do want to take some time to answer any questions that have come up as we've been discussing tools for weight loss. And while we're collecting those, Casey's going to join in with us to answer some of these questions. Just wanted to point you to our website here, www.formhealth.co, if you want more information. We also have a poll that's popped up, if you're able to see that, asking if you've ever tried medical weight loss before. So if you'd like to answer, feel free.
Yeah, so some of the questions that have come up is, could you maybe clarify more what happens when you get to your goal weight and might need to, do you stop taking the medication, or is there a taper down, or what's the process?
That is a great question, and definitely a conversation I have frequently with patients. So honestly, there's not one good answer. Each patient is going to be different. Some patients really feel comfortable with the medication. They're not having side effects. It's helping them meet their weight loss goals, and they decide to continue with the medication. Other times we may talk about trying to taper down or off of the medication and seeing what happens. And importantly, if tapering off of a medication or stopping the medication, that continued accountability, support, and tracking of weight can be really helpful to see if the weight is starting to go up. There's no way to predict if someone is going to be likely to regain that weight. And so I think it's important to keep a close eye on things as time goes on and intervene sooner rather than waiting until someone has completely regained the weight that they've lost.
Great. Another question that came up is, what are some of the side effects that might be related to some of the medications?
Okay. So side effects of medications are, of course, going to depend on which medication we use. The GLP-1 receptor agonist, for example, as I mentioned, can slow digestion. So when you think about that, when food's kind of sitting around the stomach, you may feel nauseated. Some patients also get acid reflux, and then some patients get constipation or diarrhea. Other medications, for example, the naltrexone bupropion or Contrave, some patients experience headaches, dizziness, constipation, and sometimes there are mood changes like increasing anxiety. With phentermine and phentermine topiramate, commonly see dry mouth as a side effect, and the topiramate component may cause numbness or tingling in the hands and feet. Some people also notice a little bit of brain fog, or sometimes they're forgetting words like, where was I going with that? Oh yeah, that thing. And then orlistat, because it works by blocking fat absorption, as you can probably appreciate, because you're blocking the fat from being absorbed by the body, it has to come out somewhere else. So you can't have oily stools. And some patients do actually have accidents. Honestly, that is my least favorite medication. I don't think I ever prescribed that, but there may be certain cases where that is the best option. So it all depends on the patient. Finally, with Plenity, because it forms this fiber gel and expands in the stomach, it may cause some abdominal distension, bloating, gas, and then for some people, constipation, other people, diarrhea. But it really is going to depend on the patient. And these are just some of potential side effects. So it really will depend.
And then another question was, how long does it take to start actually seeing progress on the medications?
Okay. So in general, with a weight loss medication, what doctors look for is that you've lost about 5% of your body weight in the first 3 months of taking that medication. And in fact, when you look at clinical trials of these medications, that is usually like the primary endpoint for one of the studies to see, do we meet that benchmark? Now, I talk to patients, and luckily at Form Health, I get to see my patients once a month. So when I meet with them a month later, depending on where they are in the medication, in some cases, the medications take time to taper up to get to the maximum dose. We'll see, are they noticing an effect on their appetite? Is it easier for them to make better choices with their food? Are they seeing changes on the scale? And as I mentioned, not every medication works for each patient. So having that touch base point is really important so we can decide, is this working or not?
So that's all the questions for right now. If anybody has any other questions, please add it to the chat section. If you want, I can go over some of the lifestyle changes that we like to discuss.
Sorry, Casey,
Yeah.
to interrupt.
Yeah,
We have
sure.
two questions in the question and answer section that have popped up that I think, but if we can answer those as well.
Yeah,
Oh,
definitely.
I see them. I see one that's asking about Plenity. If someone has tried to take the medication before but was told they were not a candidate, why is that? Or what, are they not able to take it again? That would be a discussion to have with your doctor to see if you are a candidate. I know that there have been some recent changes to the medication where now doctors can prescribe it more easily, as before it was a little bit of a barrier there. And then someone was asking about medications that are available in the United Kingdom. Fortunately, I cannot clarify what medications are available there because I don't practice in the UK. So I'm not familiar with all of the weight loss medications, but some of them I would presume are available there as well.
And some other questions were, what are some of the costs if insurance doesn't cover them? And does Medicare normally cover the medications?
Oh, that is a great question. So at this time, Medicare does not cover weight loss medications, which I could talk for a very long time about how frustrating this is and unfair this is. But unfortunately, that's not going to make a difference in the long run. It is up to our politicians to really realize that this is a major health problem that needs treatment, and we have great treatment options, but payment for them may not be available. And there have been some work with lobbyists in the past trying to get coverage for this. And hopefully we're making some progress here. Every once in a while, I see a news article about it and I get really excited because I know so many patients who could benefit. In terms of out-of-pocket costs, what I can tell you is the GLP-1 receptor agonists are the most expensive medication on the market. Out of pocket, you're paying over $1,000 a month. And for most people, that is not affordable. For other medications, honestly, phentermine is the least expensive, and that's because it's available as a generic, and it's been around since literally the 1950s. So it is not one of those newer medications, which tend to be more expensive. And then orlistat, also available over the counter as Ally for reduced costs. I don't know the exact cost on that one. For Contrave and Qsymia, there are some mail order pharmacies that are able to provide the medication to patients for around $100 a month, which is definitely more affordable than $1,000 a month for a lot of people. And actually, Casey, one other thing, I will say there was that list of medications that are used off-label for weight loss. So those actually might be covered by insurance. Let's say your insurance may not cover Qsymia, they may cover phentermine and topiramate separately. So there's other nuances to the costs as well.
One question that came up is a patient took a medication called Redux. I'm not sure if I'm saying this right, REDUX years ago, and was wondering if there's anything similar to that now. I don't know if you're familiar with that.
I'm not familiar with that trade name, but I'd have to Google it and see which one it is. But I can't comment on that.
And then another question was, can any of these medications come in a powder form, and maybe speak to how the medications are taken? Some of them are shots versus pills.
Oh yeah, great. So the medications, Saxenda and Wegovy, which are GLP-1 receptor agonists, are given by injection. And then all the other medications are taken as pills, including Plenity. It's a capsule, but you take that with 2 large glasses of water.
Do you happen to know off the top of your head any specific insurance companies that cover the weight loss medications? in case anybody
That
needs any?
No, and the insurance company part is very challenging because while there are, large companies within each state or within each employer, there may be certain types of coverage that is there or not. For example, coverage of weight loss medications may or may not be included. So it's not like a blanket, statement that, oh, this insurance company always covers weight loss medications. So unfortunately, on the patient end of things, there is some research that may need to be done ahead of time. What I end up doing with patients is, I'll have their insurance information and we'll send it to the pharmacy, and the pharmacy will get back to us saying, oh, this needs a prior authorization. And then we go through that paperwork to see if we can get that covered for a patient.
Another question was, what would be the minimum weight? I guess this probably would depend on each patient for being able to take these medications.
Yeah, it's going to depend on the body mass index. So whatever your height is, then you can plug in what would my weight need to be to have a body mass index of 30. Or if you have a weight-related comorbidity like high blood pressure, high cholesterol, then that drops down to 27.
And then I think that you answered this already, but are we allowed to do any medications for people who don't live in the United States?
Unfortunately, no, we're not.
Okay. And then another question that came up was a patient has tried Ally in the UK in the past, and we're wondering if there was any other medications that might work instead of the Ally.
There are a number of other weight loss medications, but really determining what might be the best fit for a person is honestly a individualized discussion to have with the doctor, because we really have to consider other factors like, what is your medical history? Do you have other medical issues? Or, are you someone who tends to have a lot of acid reflux? Then maybe using the GLP-1 receptor agonist is not the best option for you, for example. So it's done on a case-by-case basis.
That is all the questions I see now. Again, if you have any other questions, please don't hesitate to add it to the chat or the Q&A section.
And then I was hoping, Casey, maybe in the last couple minutes that we have, maybe you could talk a little bit about your perspective as a dietitian at Form Health, what that experience is like working with patients.
Yeah, so to kind of go over the program a bit, we here at Form Health are really motivated to make sure that you are getting long-term success. So our one-on-one sessions, we really want to try to get to know you and learn your everyday patterns to really make sure that this is a healthy, sustainable plan for you. This is not a cookie cutter approach. We don't have a one size fits all plan. So, when you're meeting with your dietitians and your doctors throughout your visits, normally for the dietitian, we meet about every 2 weeks. And between visits, we stay in touch via the messaging part of the app. So when we come up with your individualized plan, if something's come up and it's not working, then we can change it right away. If something unexpected came up, like a trip, or you're going out to dinner with friends and needed to know how to incorporate this into your meal plan, we're there for you to help as much as you need between visits as well. But to kind of discuss more, about our actual, the meal plan that we come up with you, we really make sure that it includes all of the food groups. We're not cutting anything out. We make sure that you have good proteins, good produce, good amounts of carbohydrates, and we work on making sure your meal options are in appropriate portions to make sure that you stay full and satisfied throughout the day. So, a lot of patients come to me worried that I'm going to say they can't have this or that. And, don't worry, I never take anything away from my patients. I always try to make sure that if there's something that you want, we can definitely, incorporate it into your meal plan. So we try to make sure that it's not restrictive. For most patients, we're not having you count calories. We're really just trying to develop a plan that works best for you. And, some of the questions that sometimes come up is, do I have to have 3 meals a day and 3 snacks, or what's the normal schedule look like? And again, for everybody, it's going to be different. Some people are not breakfast people, and I completely understand that. So maybe they want to skip breakfast and have just lunch and dinner and a snack. Or maybe they want to do a meal replacement, like a shake or something at breakfast, and then have, 2 other meals throughout the day. So we really adjust your number of meals, your number of snacks, depending on your lifestyle and how hungry you are throughout the day, and what really works best for you. And also to keep in mind too, in your sessions with both the doctors and the dietitians, we not only work on your meal plans, but physical activity and incorporating small changes in movement throughout the day. And then we really focus on those mindset shifts as well. Most people have been on some sort of diet in the past, and for multiple reasons those have changed and they haven't worked for you. But we really want to not look at our program as a diet per se. It's a lifestyle, and we're really trying to help you develop these patterns and these sustainable small changes throughout the day that can work to help you, lose your weight and then keep it off as well.
Yeah, and I just want to echo what Casey's saying about lifestyle changes. And, when thinking about the nutrition component of weight loss, this has to be something that's sustainable, something that you can do long term. I mean, studies show that what is most effective for weight loss from a nutrition perspective is what people can stick with. And so, I just think it's so wonderful that we're able to offer this to patients and have people like Casey, who are just so experienced and so supportive, really provide that perspective that is missing from a lot of other programs as well. Well, it's about 9:31. Do we have any last questions before we wrap up here?
There was one last question. I think this
Okay.
is a good question to end on, because it asks, is it a good idea to take the medication just to help start the weight loss process? And then to see results to get motivated?
That is a really hard question to answer because each person is going to be very different. Again, there comes the component of, okay, well, if we start a medication for weight loss, are you then going to, after stopping the medication, start to have that hunger come back and regain the weight? And for some patients, we talk a lot about maybe just starting off with the lifestyle changes and see how those go. And then if needed, add in the medication. Whereas other patients come to me and they say, look, I've tried those lifestyle changes over and over, and it just is not working for me. And that's where we might start off with the medication in addition to the lifestyle changes. But thank you all so much for your wonderful questions, and feel free to reach out to us if you're interested in learning more. Website's www.formhealth.co, and hopefully Casey and I will get a chance to work with some of you in the future. Take care, everyone.
Bye.